Thank you for choosing to have your pet spayed or neutered at Carroll House Quick Fix Pet Clinic. Here are some important post-op instructions. Your pet was under anesthesia and received a pain medication injection at the time of surgery. Please follow the instructions for medication going home with you closely. Only give meds to your pet that we provided. No over-the-counter drugs should be given, as some can be dangerous or fatal. Your pet will have a surgical incision and a permanent tattoo. Male and female dogs will have dissolvable internal sutures and a skin glue closure. Some male puppies will have 2 scrotal incisions with a skin glue closure. Female cats will have dissolvable internal sutures with a skin glue closure. Male cats will have 2 incisions over the scrotum with no glue or skin sutures. Check the incision and tattoo site twice daily. You should not see any redness, swelling, bleeding, draining, or an open incision. Keep it dry and let it heal on its own. Do not apply topical medications and no baths for 2 weeks. We will provide you with the post-op nurse line, a number you can call between 8 a.m. and 8 p.m. daily with any questions or concerns. Watch for these abnormal symptoms in your pet: pale gums, depression, lethargy, unsteady movement, loss of appetite or decreased water intake, vomiting, diarrhea, discharge or bleeding from the incision, difficulty urinating or defecating, or labored breathing. If your pet has an emergency or needs immediate attention, please contact your vet or the nearest emergency vet clinic. Always have a backup plan. We offer free surgical rechecks for your pet. You can arrange a recheck visit by calling our post-op nurse line. E-collars are recommended to prevent licking and chewing of the incision. It should be worn 10 to 14 days. Licking the incision site can lead to infection. Make sure your e-collar fits properly and goes past the nose. Do not trim the e-collar. Restrict your pet's activity for the next 10 to 14 days. Assist your pet in and out of the car. No jumping should be allowed from a car or furniture. Running, jumping, and playing may lead to swelling, infection, or the incision site splitting open. Keep your pet indoors for 10 to 14 days. Do not give them free roam of the yard and no tie-outs. Be prepared to keep multiple dogs or multiple cats separated. Feral and community cats should be kept in a climate-controlled, clean area. Do not let them out immediately or in bad weather. Here are your feeding instructions. This evening, a small amount of food and water should be given. Do not overfeed them. You can modify your bowls if needed or take the e-collar off while they eat. Let's recap your checklist. Visually inspect the incision site daily. That means look at it. Keep the post-op nurse's number handy. Last but not least, did you purchase an e-collar? Thanks again for choosing Carroll House Quick Fix Pet Clinic.